Hi everybody, I'm Zanny and I am here to talk about bulimia nervosa, which is code 307.51. And I'll go ahead and start with the diagnostic criteria. To begin with, a diagnosis requires recurrent episodes of binge eating, and an episode is characterized by both eating during a specific period of time, which is usually less than 2 hours, an amount of food that is considered larger than most people would eat in a similar period under similar circumstances. And also, it requires that the individual has a sense of lack of control over the eating during the episode, which could also be described as feeling that he or she cannot stop eating or cannot control how much she is eating. Criterion B is that there are recurrent inappropriate compensatory behaviors that are taken to prevent weight gain, and examples of which are self-induced vomiting, misuse of laxatives, diuretics, or other medications, fasting, or excessive exercise. And many individuals use more than one method to compensate. This criterion is called purge behaviors or purging. Criterion C is that if both of the first two criteria are met, the binge eating and the inappropriate compensatory behaviors, they must occur on average at least once a week for 3 months. And criterion D is that self-evaluation is unduly influenced by body shape and weight, which is extremely important in determining the individual's sense of self-esteem. Criterion E is that the behaviors do not occur exclusively during episodes of anorexia nervosa. And those with bulimia nervosa may closely resemble those with anorexia nervosa based on the fear of gaining weight, the desire to lose weight, and the level of dissatisfaction with their bodies. But a diagnosis of bulimia should not be given when this disturbance occurs only during episodes of anorexia nervosa. Further specifications are being in partial remission, which is after the full criteria for bulimia nervosa had been met. Some, but not all, of the criteria are still being met for a sustained period of time. And then being in full remission is described as after the full criteria were previously met, none of the criteria have been met for a sustained period of time. And the specification also includes severity, and the minimum level of severity is based upon the frequency of the inappropriate compensatory behaviors. So mild severity indicates an average of 1 to 3 episodes of inappropriate compensatory behaviors per week. Moderate severity is 4 to 7 per week. Severe would be 8 to 13. And then extreme severity is an average of 14 or more inappropriate compensatory behaviors per week. So next, I will talk about the diagnostic features. And the clinician should consider the context of the episode. For example, the food intake, which could be thought to be excessive during a typical meal, might be considered normal for a holiday or a celebratory meal. And it's also important that the clinician consider what is considered a discrete period of time, and that it refers to a limited period of time of the episode, which is usually less than 2 hours. But that does not have to be in one setting. For example, the episode could begin in a restaurant and then continue at home. Some people describe having a dissociative quality during or after the episode. And the type of food consumed varies, but the binge eating is characterized by the abnormality of the amount of food. But binge times, however, individuals do tend to eat food they might otherwise avoid. And individuals with bulimia nervosa are ashamed of their eating problems and make attempts to conceal their symptoms. And the binge eating usually occurs in secrecy or as inconspicuously as possible. The binge often continues until the person is uncomfortably or painfully full. And the most common antecedent of binge eating is negative affect. And other triggers include interpersonal stressors, dietary restraint, negative feelings related to body weight, body shape, and food, and boredom. In terms of prevalence and development, the 12-month prevalence among young females is 1 to 1.5%. And it most commonly begins in older adolescence or young adulthood, and any onset before puberty or after age 40 is not common. As for suicide risk and functioning consequences, we do see an elevated suicide risk in bulimia nervosa, and the DSM-5 indicates that a comprehensive evaluation should include assessment of suicide-related ideation and behaviors, as well as risk factors, including a history of suicide attempts. And also, we see a range of functional limitations, but the social life domain is the most likely to be adversely affected. For differential diagnosis, if the binge eating behaviors occur only during episodes of anorexia nervosa, the diagnosis will be anorexia nervosa, binge eating purging type. If the individual does not engage in inappropriate compensatory behaviors, then the diagnosis would be considered binge eating. Overeating is common in major depressive disorder with atypical features, but if there is neither inappropriate compensatory behavior nor excessive concern with body shape and weight, if the criteria are met for both disorders, then both disorders should be given. And binge eating behavior is included in the impulsive behavior of borderline personality disorder. And if the criteria for both borderline personality disorder and bulimia are met, then again, both diagnoses should be given. And finally, we'll address comorbidity. Comorbidity with mental disorders is common. Most individuals experience at least one mental disorder, and many experience multiple comorbidities. We see an increased frequency of depressive symptoms, such as low self-esteem and bipolar and depressive orders. And for many individuals, a mood disturbance begins at the same time or following the onset of bulimia. And there may be an increased frequency of anxiety symptoms, such as fear of social situations or anxiety disorders. And these mood and anxiety disturbances will frequently lessen following an effective treatment of bulimia. The lifetime prevalence of substance use, particularly alcohol or stimulants, is at least 30% for people with bulimia. A large number of individuals also have symptoms that meet criteria for one or more personality disorders, the most frequent being borderline personality disorder. So thanks very much for watching.